Hello, everybody. Hello, dreamers all around the world. Today we have super cool topic because we're going to talk about the myths about the blood donation. And today with me, we have the special guest, which is Dr. Ross Herron. And Dr. Ross is working for the American Red Cross blood donation services. And I think it's a best possible expert that we find out in the internet because Doctor is dedicated to increasing the amount of blood donation across Southern California and has been responsible in making public pleas for donors to step forward. And maybe just a little bit of background when I call to set up the interview with Doctor. They told me it's a wonderful person, and you will see that's true. Just a little bit background. Doctor graduated from Pennsylvania State University with the highest distinctions, and it's the best expert out there. So, Dr. Ross, it's great to have you here. It's my pleasure. I'm really excited to go with this interview. Ross, if you could tell me, first of all, what is the problem? Is it not enough blood around the world right now? Are the people dying because of not enough blood out there?
So in the countries like the United States and the UK and Australia and Canada, there's usually enough blood available for patients who need it most of the time around the calendar. There would be spot shortages usually around times of vacations, around Christmas and New Year's, for instance, also around July 4th holiday. And summer can be a prolonged period of blood shortage time where we're struggling to have enough for everybody who needs it, patients in need. Now, that's the industrialized countries. And so the other countries around the world that aren't quite as developed, they have less sophisticated blood donation systems. And so in those locations, there can be severe blood shortages. Most of the time, it doesn't lead to a patient death, but on occasion, I've heard that in some countries, there just isn't enough blood to go around, and it contributes to patient disease and death, like, for instance, maternal death from bleeding, and there's not enough blood to be able to save a person who's having marked bleeding at the time of childbirth in the countries that aren't well developed regarding their blood donation system.
Mm-hmm. Okay. So out there exist something like the blood banks that the people can or the hospitals can take from? Could you tell me something more about the infrastructure that exists right now?
Okay, so the infrastructure depends upon the country in which you live in.
Mm-hmm.
I'm in the United States, so I'm most familiar with it. So I'll start with the United States.
Yeah, sure.
So,
let's talk about the United States most of the time.
Okay, so in the U.S. we have the American Red Cross, which collects about 40 to 45% of the blood supply in the country.
Wow.
We have a bunch of independent non-Red Cross blood centers that collect the remainder. And there's a small amount of hospital-based donor centers which have their own collections located in their own hospital or in the communities around their hospitals. And so those are all not-for-profit organizations that collect volunteer blood donations. We are all under the guidance of the Food and Drug Administration for safety and quality of the blood product. Mm-hmm. And so we all work usually in different geographies. Sometimes there's overlap, and we're collecting blood in the same geography, but getting the donors to come out. And so there are blood centers across the country, usually a central blood center. For instance, in Los Angeles, we have one in the Pomona area of Los Angeles. And then there are usually fixed sites in California. For instance, in Los Angeles, we have 12 fixed sites around the Pomona location throughout LA County, Orange County, and San Diego County, where people can come in and donate blood, and that's a significant portion of the supply. The other portion of the supply is based on community donations, where we bring the blood drive to a location like a social club, a school, a church, and we set up in enough space the area to have a blood drive, and that's a significant portion of the blood supply in the U.S. on a daily basis is done by going to those particular locations, bringing the blood drive there, having recruited the donors in advance, then collecting the blood and bringing it back for central manufacturing. And that's the model in the United States. It doesn't vary much depending upon what organization you're looking at, whether it's Red Cross or non-Red Cross. And so in Canada, it's very similar. They have two major organizations, Canadian Blood Services and HEMA Quebec. And so they complement each other, HEMA Quebec being in Quebec, Canadian Blood Services being in the rest of the provinces. And they work very similar to what the American blood donation centers look like. Same thing goes for Australia and the United Kingdom, although they have one national service. That they don't have multiple blood collection agencies. They have one government-supported national service that does the collections, but they're arranged very similarly. And then other countries around the world will either have multiple collection agencies within the country, or they'll have one government-sponsored collection agency. And those are the models that are used to collect blood donations. After they're collected, then of course they come back and they're manufactured, tested, and they're approved for release for patients. And then we have distribution mechanisms to get them out to the hospitals that need them. So they have their own inventory and their own inventory levels, and then we keep their inventory levels at hopefully high enough levels that they have what they need for any patient who needs it whenever they need it.
So there is a problem around the blood exists right now, or actually everything is fine and everything is working fine and there's enough blood, or is this any problem exist there, out there?
Well, in the United States currently, because the hospital is continuing to need blood for patients during the summer, patients don't get a summer vacation. They're year round. But donors go on summer vacation, particularly around the time of July 4th. We have an ongoing need for blood donations. Our inventories are lower currently than we would like them to be. That's primarily related to donors not being available and blood drives not being held during the summer. A significant portion of our blood comes from, up to 25% comes from high school and college donations. And during the summer, of course, they're not in session. So we have to make up for that loss of those particular donors and blood drives. So we do smaller blood drives, community blood drives. A lot of businesses, though, their folks are on vacation, and so they don't have enough folks to be able to do business and have a blood drive. So they'll wait until the fall or winter to have a blood drive. So summer tends to be a tough time, and currently it is a tough time. A smaller thing that we're dealing with in the U.S. right now, which is affecting the blood supply, is Zika virus. Well, we have travel deferrals for people who've traveled to countries where Zika virus is actively transmitted, and so they're deferred for 4 weeks, and so that's causing us a little bit of problem with some of our donors, because depending upon what location you're in, like Los Angeles or New York City or Miami, there's a significant amount of travel to countries that can be have Zika transmission. So that's something that's on our radar screen too, which is not helping the blood supply currently.
So could you tell me, do you think this, if we will be able to gather this or inspire people to donate 1 million liters of blood, do you think it will be meaningful in case of around the world, or it actually will be only drop in the ocean?
1 million liters, in Red Cross, we collect 500 milliliters at a time, so that would be 2 million blood donations. That's not a drop in the bucket. That's a significant addition to the world's blood supply. So the U.S. blood supply, it would be a major addition. To the world's blood supply, a little less so, but still a major gift to the world and the patients who need blood. We collect about 15 million units of blood in the United States, something like that a year, 14, 15 million. So 2 million donations, or 1 million liters, would be a significant a gift to the communities that need blood.
That's good to hear. Let's say I'm in the United States right now, and I get inspired, I decided I want to donate the blood. So shall I go to Red Cross website and find a place where I can donate, or how I can find that? What I should do? What is the process?
Okay, so if you're in a community where the Red Cross provides blood donations and blood services, then there's a couple ways you can get in touch with us. The old-fashioned way is to call 1-800-RED-CROSS or 1-800-733-2767, and you can schedule a blood donation. The newfangled way and the new technology way is to get online at redcrossblood.org, and you can go in and schedule a donation that way. And even more technology-based is our blood donor app that we have, our Red Cross blood donor app, which is available from either the Google Play or the iTunes stores for free. And you can download the blood donor app, and then you can go on into the app, and you can find available places to donate, schedule your own appointment, and start your blood donation history there with something that we call Rapid Pass. And so there's lots of ways to get involved with the Red Cross. If the Red Cross doesn't collect blood in your area and you try to access one of those mechanisms, we will refer you to a blood center that's in your area if you don't already know which blood center collects in your area.
Ross, I hope so. That's not. I know it might sound like a really simple and easy questions, but I think what we finding out that a lot of my peers and a lot of people here in our community actually want it, and we have this little blocks or those little unknown things, and that's why I'm asking those questions. And hopefully this podcast will actually delete all the blocks, and we'll have the army of people going there and donating more blood.
That's great. Yeah.
Okay, cool. So could you tell me, first of all, am I going to feel bad after I'm going to donate the blood?
So most people who donate blood do not have a reaction to it. They feel a warm, fuzzy feeling for doing something good for patients in need, and that's what they take away, plus usually some juice and cookies at the end. And so that most people do not have a reaction. Some people can have a reaction where if they donate blood, they may feel faint. Some actually may faint. It's a very small percentage that happens, and then we treat that by giving some fluids and having the person rest for a while and monitoring them. And then the other thing that happens with donor reactions or complications is that you're sticking a needle in somebody's arm, so a bruise can occur, right? Because we use to get the blood donation, we have to use a fairly big gauge needle, so it can cause some bruising outside of the vein and up underneath the skin. And so bruises can occur at times, and those are the most common things. But most people don't experience those. It's a pretty straightforward process, and they come away feeling great about their experience.
Yeah, that's probably that's the biggest takeaway of actually this feeling of doing something good for another human being.
Yeah, there's only a few ways you can be an everyday hero, and this is one of the ways you can do it. You can step up and share your blood for somebody who doesn't have enough of their own.
Okay, so from body perspective, how long my body needs to generate the same amount of blood inside of my body?
Okay, so for a whole blood donation, if you do a whole blood donation where we take out the red cells, the plasma, and the platelets as one donation, we would then manufacture that into a separate product. It would take you a little while to make your red cells back. You can't donate any more frequently than every 56 days when you're donating a whole blood. So it takes probably somewhere in the range of 4 to 6 weeks to make back all the red cell volume. If you have a really good diet and a high iron level, you can maybe make it back faster than that. And if you don't have a good diet, it takes a little longer to make it back potentially. But usually within 56 days, your red cells will be back to normal. Plasma comes back to normal. The blood volume itself with plasma, if you hydrate well, within 24 to 72 hours, your blood volume is back to normal.
So the most of our community here, it's young people, and definitely the question will be asked. It's about marijuana. So I know a lot of myths. Some people say you can donate the blood if someone smoke. Let's say we're talking about the places like California where the marijuana is legal, and other places.
Yeah.
And so what about this case? Could you tell me something more?
Okay, so for medical marijuana, if you're taking it because you have an underlying disease, your eligibility will depend upon your underlying disease, right? So if you have a particular disease for which you're taking it and it would not be safe for you to donate, or it wouldn't be safe for a recipient to receive your blood, then you won't be able to donate. But if your underlying disease is fine for you to donate, and the recipient won't be affected by your underlying disease and your donation, then the fact that you use medical marijuana doesn't influence your eligibility to be a donor, as long as you're not under the influence of marijuana at the time you come in to donate, because you have to give an accurate health history and donor history questionnaire.
Sure.
So that answers the medical marijuana question. For recreational marijuana or other recreational drugs, the same kind of rules apply, not the disease state thing, but you have to be not under the influence. So alcohol, marijuana, other recreational drugs, as long as you're not under the influence at the time you come in to donate, then you're eligible to give. One thing that is, I mean, in the concept of recreational drugs, but is injecting drugs. And if you inject drugs, then you're not eligible. You're indefinitely deferred from donating if you've injected drugs, either intramuscularly or through your IV.
Okay, but we are talking about the hard drugs, tipo heroin, or things like that.
Yeah.
Okay. Let's say, can I need to have any special treatment like day after or the same day after I donated the blood?
So what we recommend is that you eat a nutritious diet all around the calendar, right? But particularly leading up to your time of donating blood, you have don't skip meals, eat a nutritious non-fatty meal, that kind of thing. Don't skip breakfast. Hydrate well. Make sure you have lots of fluids. In particular, fluids that don't cause you to lose water. So like caffeinated beverages, not probably as good as water or juices, for instance, or sports drinks, because caffeinated beverages, you tend to get rid of some water at the same time you're bringing the beverage into your system. So we ask you to do that. And then after you donate, we'll give you additional fluids and some cookies and snacks. After that, it's back to eating your regular diet. And we recommend that if you're in a profession in which you need, like a firefighter or policeman operating heavy machinery, that you don't do that after you've donated blood for at least a short period of time. So we would recommend those folks sort of donate after their shift is over and have a chance to go home, right?
Okay.
Other than that, unless you're an elite athlete, your regular performance is probably not going to be affected much. If you're an extremely elite athlete, like a world-class marathoner, you would want to schedule this into your training regimen so that you weren't going to be competing right after you donated blood, for instance, because it would probably bring your times down a little bit, for instance.
Okay. So I heard also that actually blood donation is good for us. Is that true?
There have been some studies that have looked at, in particular in men, the rate of heart disease in people who donate blood versus that don't donate blood. And there's something called the iron heart hypothesis, that if you have a high iron level, it can cause you to create what's called free radicals, which can affect your heart and cause you to have heart disease in the long run, atherosclerosis, coronary artery disease, heart attack. And so they've done some studies to look at that, and they have shown that blood donors tend not to have as high a rate of heart disease. The problem with that is that blood donors go through a health history questionnaire at the beginning of blood donation. And we ask questions about heart disease. We ask questions about a number of different things. And we do a mini physical, which has your hemoglobin level to show you have enough red cells to donate, shows what your blood pressure is, it's adequate, not too high, not too low, shows your pulse rate's good, your temperature's good. So it's a little mini physical exam. And that screens out the donors who have a higher risk, and if they're deferred, and the ones who have lower risk continue to donate. So that association hasn't necessarily been proven as a cause and effect, that when you're donating blood and you're decreasing your iron, that you have less heart disease. So we don't really tout that as something that donating blood is good for you as far as for your own health. The other thing is, if you donate very frequently, you can drop your iron level to a level that's not enough to replace your red cells, and you'll get anemic. And you need iron to make your red blood cells, but also to do other things in your body. So if somebody's a frequent donor, we tell them to take iron supplements, for over-the-counter iron supplements, or multivitamins with iron. And we define frequent donors as men who donate more, 3 times or more a year, women who are past their age of childbearing who donate 3 or more times a year, and women who are in their time of childbearing two or more times per year. We recommend them to take an iron supplement to replace the iron they're losing at the time they donate blood. So there's not a whole lot of, the number one benefit to donating blood is that feeling that you get about helping somebody else. There's not a whole lot of else besides, as far as physical benefits to yourself, but mental benefits, there's lots of those.
Mm-hmm. Okay, I understand. Could you tell me the most interesting story with connection with the blood donation that you have in your career as a doctor?
Boy, there's a lot of unique ones that have come up as far as people having eligibility to donate, because we have lots of procedures that say, who can donate and who can't donate, mm-hmm. and that if a person's condition is not in that very lengthy procedure, then staff are required to get in touch with us, the medical directors of the blood centers, and get approval to donate. So on occasion, we'll get something that's a genetic disease, which is pretty rare. We haven't heard of it or something. I actually got a call one time from a donor who had been told he had heartbreak cardiomyopathy. Mm-hmm. And I had never heard of heartbreak cardiomyopathy. Okay. But apparently after a large breakup in a relationship or stress, that there can be effects of the stress on the heart, and up to and including arrhythmias and the heart not functioning appropriately. Mm-hmm. And so I had to investigate that and find out what was going on with this particular donor. And it turned out that he had had a stressful breakup in his marriage, and so he did in fact have heart symptoms related to the stress of his life. Mm-hmm. But he was fine to donate. We talked about what his vital signs were. We talked about what effects he had, how he had gotten it treated, and we approved him for donation. So that's just off the top of my head, one of the interesting things that you have to deal with regarding blood donation.
Basically, I would like to ask, Doctor, how's that happen that you became passionate about the blood donation? And actually, when did you know in your life that you want to be a doctor and you want to help serve people?
Well, I was in high school and trying to figure out what I wanted to study in college, and I liked biology quite a bit. So I went into college and studied biology. I thought maybe I would be a wildlife biologist and be out doing naturalist things, studying animals, etc. Mm-hmm. Always liked that when I was younger. And then I got into these biology courses that were studying human physiology, anatomy, etc. And I realized that that was a great way to stay in biology, but also head towards a career in medicine where I could help others. And so that's how I got involved in going into medicine, was through an interest in biology. While in medical school, then eventually you choose what field you're going to go into. And I like patient care, but I also like laboratory medicine. And so I decided to go into pathology and laboratory medicine. But once I got into it, I decided I didn't have enough patient contact in most aspects of pathology and laboratory medicine, except for blood banking. Blood banking and transfusion medicine allows you to be a consultant to patients and physicians, as well as doing the laboratory aspects that are involved. And that's how I got into transfusion medicine, blood banking. Haven't looked back, and I've been in it for a number of years, over really, I guess I would say about 25, 26 years I've been in blood banking. So, and it's one of the only places in medicine where you can put two people in touch with each other. They don't know each other, they're anonymous, but one's helping another through the gift of life, through the gift of blood. And so I think it's a miraculous place to work, and it's been rewarding over the years.
Is it sending the blood to another countries even possible in these days?
Okay, so it is possible to send blood from one country to another. It's not usually done very often. Usually the blood in one country stays within that country. There's usually a regulatory body that oversees blood collection and blood transfusion. So the rules can be different from country to country. There usually is enough blood in most countries where you don't have to ship it around, but if there are times of shortage or large disasters, for instance, we will ship it around. It has to go through customs, of course, and that could be a problem because of the timing and the length of blood, length of time that blood can be kept in transport, because you have to have it iced depending upon how it's stored, etc., or kept at room temperature. So often if you're going to send stuff from country to country, you have to have special customs brokers involved and potentially the State Departments of the different countries to be able to move stuff back and forth. But it's been done. It's mostly done in cases of rare blood where an individual has made an antibody through childbirth or through previous transfusions to a particular red cell type, and they need a very rare unit. And so we will bring units in from wherever we can find them in the world. If we don't have them in the U.S., for instance, we'll bring them in from Asia, Australia, wherever we can find a match. And we've brought in units from Japan, and they happen to be 250 ml units rather than 500 ml units, so you have to bring two for each one that you want for an adult dose. But and then they come with different labels, labeled in the native language of that country. So it makes for some difficult things. But yes, you can move blood around the world if you need to.
Ross, I would like to ask those a few last questions. Let's imagine that you have access to 100,000 young people.
Yeah.
What meaningful we could do for another human beings?
Well, from the blood donation perspective, you can donate every 56 days or at least twice to 4 times a year. And so that would be getting that on your regular schedule and becoming a regular blood donor would be great. There's also something we call apheresis technology, where you can donate using an instrument that takes out just platelets or plasma that we need and gives you back your red cells. And you can do that up to 24 times a year. Okay. So that's something you can do even more frequently than red cells, and get it on your calendar. And come back on a regular basis, like every 2 weeks or every 3 weeks or every month. And so that's something from a blood donation perspective that people can, put it on their calendar, make the time to do it, make the commitment. It's pretty quick. It doesn't take too much time. And then you're providing needed blood products for people who otherwise would have a bad quality of life, or they wouldn't have life at all. You're saving lives or helping with the quality of life. As far as what other things people can do, there's so many other things that people can do as well. If they have the time on their calendar, they can volunteer with your blood center, help in the canteen area, help with registration, help in any part of the blood donation process, including distribution, manufacturing, that sort of thing. And that's just the blood donation area or blood center area.
Okay. From the medical perspective, is it anything, let's say, let's imagine we already did a big contribution to the world, or a lot of people become the donors. What is the next step? Is it the donation of bone marrow, or is it anything else that you see from medical perspective that we as young people, as a young idealist, could do?
I think. If you're interested in providing stem cells through bone marrow or peripheral blood stem cell collection, there are registries around the world. In the United States, it's called Be the Match, the National Mirror Donor Program, the Be the Match registry. Mm-hmm. So you can enroll on the registry. You can also, in most states, and at least in the United States, there are mechanisms where you get your driver's license. You can sign up to be an organ and tissue donor. Mm-hmm. So if you were to happen to have a bad event and pass away, but your organs were still good or your tissues were still good, you could then donate to the next generation by having your organs and tissues be approved for donation. Other thing is also pregnant women who are delivering a baby. In the placenta, after they've delivered the baby and the placenta is delivered, there are placental cord blood cells, stem cells, and those could be harvested and put into a registry as well, and be providing stem cell transplants from that source for kids who might need them, or smaller adults who might need them. And so that's something that you could do as well.
Okay, that's interesting. So my last question will be, if I would like to, if I would like to become an organ donor, and let's say I'm a citizen of United States, what should I do to put myself on the list?
So I think an organ donor, I think that it's going to be dependent upon what state you're in, but for the most part, state by state, there's usually, as part of your motor vehicle registration or your driver's license process, there's usually an opportunity to have on your license a sign up that shows that you are indeed agreeing to be an organ donor. And so if you were to get into a motor vehicle accident but your organs were still good, they would check your driver's license, and if you were an organ donor, they would contact the agencies that do organ donation and tissue donation. Then they would come out and provide that whatever organs were needed to the person on whatever list that needed an organ. So that's the number one thing to do. I think it's all through the DMV in most states.
Okay, Ross, is it anything what I could do or we could do for you to thank you for your wonderful contribution of this phone call and spending time and explaining this to us?
Well, I think if you can get 2 million donors donating 1 million liters of blood a year, that's plenty. And if they do that, if you get 2 million donors making one donation, and then they get it on their calendar to make 2 to 4 donations a year, then we've actually gone way beyond what we could ever dream of having done. So I think that is a phenomenal effort, and I wish you all the best in getting the word out. And I want to remind people that a lot of people will come out and donate after a big disaster, but it's the blood on the shelf when the big disaster occurs that helps to save lives. And so you need to have people donating all around the calendar every day to have the blood available when it's needed. It's great that people come out and give after a big disaster to replace what was used, but it's the blood on the shelf today that saves the person who's having anything from a major event or an elective surgery.
Ross, that's wonderful. I would like to thank you so much. I know much more right now about where and how and when and what's going on, and is it anything, is it any threat for my health? But obviously not. So I would like to thank you so much. Have a beautiful day. I would like to wish you to something unexpected, beautiful happen to you this week. And so, and have a beautiful day today.
All right. Thanks very much. You take care.
Thank you very much. Bye-bye.